Hello, I'm Dr. Manjula. I'm IVF consultant at Aansh IVF Hospital, Koramangala, Bangalore. I also take care of my menopausal and adolescent clients at Yelchenahalli, Bangalore at Femcare Clinic. Continuing with the series on menopause, today I'll be talking about menopause and weight gain. First and foremost thing, any woman notices in her body even before the stoppage of menses, even before attaining menopause, is slight change in our weight. This is seen especially at the mid segment of the body, that is on the belly area and also on the waist, and some puffiness on the face. You may be wondering when you look at yourself in the mirror that you're not in shape, you're not able to recognize yourself, though you're doing the same amount of exercise as before or taking the same diet. Then suddenly you will panic and start going haywire, doing more diet, fasting, skipping your meals, or hitting hard at the gym. Here is the tip which you have to understand. The weight you are gaining at this point of time is actually helping you to cope up with the declining ovarian function, which in turn is reducing the estrogen. I'll give you one example. During in your teenage years, when you were in around 10, 11, 12 standard, or if you have seen some girls in your family or around, if they start putting on weight at that age, the elders in your family, your grandparents or your mom would have predicted that this girl, little girl, is going to attain menarche in few years. Why is it so? It is the distribution of fat, which is the fat gain is the one which is helping to produce more estrogen, which is required for that young girl to bloom into a young adult. Similarly, this fat gain which is there in menopause is the is the place of ectopic estrogen production, which is required to maintain all the parameters of the body, which is in fact helping you to improve your hair, the skin, and other changes which is happening in your body, especially the hot flashes, night sweats, decrease in muscle mass, and decrease in your bone mass index. At this point of time, you should be more worried about your other parameters. You should, rather than just going to gym and hitting it hard and trying to reduce your weight, you should just ignore that fat deposition and concentrate on your overall health. Always there's a misnomer between weight loss and fat loss. Your aim should be at fat loss, not weight loss, because weight is overall the body skeletal structure, the muscular structure, the fat and all. When you're hitting hard in gym and doing fat diets and all, you will be not only losing fat but also losing the muscle mass, which is very important. Otherwise, also in menopause, you have sarcopenia, that is loss of muscle, and bone mineral density is decreasing around 2% per year. Our main aim is to build them up by doing proper weight bearing exercises. For this, you do not have to hit hard on gym or take memberships and all. In fact, if you miss out on going to those exercises, you'll be more stressed out. Instead, use your own body weight as weight to improve your muscle mass by doing daily walking. Walking is a very important form of exercise which is underrated. During walking, your own body weight is used to improve your muscle mass in the lower limbs, that is the legs. by doing squats and stretches, arm exercise, leg exercises, abdominal exercises. We'll be strengthening those muscles. The time tested and our own yoga should not be underestimated. This is the one which comes into this way. If you want to enroll, please enroll into yoga classes. Learn proper technique of doing yoga, which can be sustained lifelong. Walking and yoga are the one which you can sustain lifelong. Okay. Other part of the thing is like eat. You not have to skip meals. Not have to go on fasting. Whatever is local, seasonal, sustainable, whatever your parents have fed you throughout your life when growing up, and those are the things which you have to eat, and moreover which are made at home and it's fresh, is actually the main remedy during this menopause and other any lifestyle disorders. What you have to avoid is the junk, the packed, the processed, the refined things, the sugary items. Please eliminate that from your life forever. Even the aerated drinks. And also eliminate the plastics, I always tell you. Lifestyle modification is basis of many diseases which is troubling us. There is no need of any fancy medications, fancy diet, fancy exercise. What is local, seasonal and sustainable is the key for healthy life. Please trust the process. You may not lose the fat around your belly drastically. It may be slowly gaining also, but that is important for you to maintain your the waning ovarian function, to cope up with the waning ovarian function during your perimenopause before you hit menopause. Trust the process, don't be behind. Fat loss, weight loss is something different, fat loss is something different. Weight, you'll be losing your muscle mass and bone health also, and fat loss you're just targeting on. But by following the weight bearing exercise, correct diet, and concentrating on your sleep, which is equally important, along with diet and exercise, and managing your stress levels, your menopause transition can be smoother. We have to live in this menopause, post-menopause changes for next 30 to 35 years. Once menstruation stops, you should not think that this is the end of the world. When menstruation stops, you are just losing out your reproductive function because there is no eggs. But that can also be helped with ERT. You can conceive even after menopause with help of IVF and ERT techniques. Apart from that cessation of the reproductive capacity, nothing else has changed. It's just a matter of transition period. Once you understand your body and you cope up with it, you can be productive, healthy, and useful to yourself, your family, and the society. You are becoming a role model for the younger girls in your family. Thank